A health influencer just claimed that eating raw salad is 274 times more dangerous than drinking raw milk. That number sounds precise, scientific even, but it's built on a misleading comparison and misses out some key context about food safety. In this video, we're going to unpack this claim, explore what the evidence says, and help to separate fact from fiction, because we all deserve to make food choices based on facts, not fear. Hi, I'm Matt Uniman, and this is foodfacts.org. We fact-check food fads so you know who to trust. Paul Saladino, a medical doctor turned health influencer with over 5 million followers across his various social media channels, recently claimed that eating raw salad is 274 times more dangerous than drinking raw milk. And this 274 times more dangerous claim has gone viral because it seems scientific, it's so specific, how could it be made up? But when you actually look at how public health assesses food safety risks, this comparison completely falls apart. The conversations about the dangers of raw milk resurfaced when a pregnant mother tragically lost her unborn child after her toddler became ill from drinking raw milk. Anne Bennett, an unqualified holistic health influencer, has, somewhat fairly said,
so why is raw milk singled out? Every food carries risks.
And on the surface, this might seem like a very legitimate claim. Salads, ice cream, deli meats, they've all caused outbreaks of illness at some point. But here's what gets lost in that claim. Public health doesn't just count the total amount of illnesses recorded. It assesses the risk per serving, the severity of outcomes, and the populations who are most vulnerable. Social media narratives, on the other hand, drop these key questions and just focus on things like, oh, I'm drunk it for the last 5 years and I haven't gotten ill, therefore it must be safe. And this creates a really misleading picture, especially for parents deciding what to give their children. So how is food risk actually framed? There's a formal framework that public health bodies use to assess food risk, and it involves 3 parts, including risk assessment, risk management, and risk communication. Risk assessment is carried out by scientific experts who identify hazards such as Campylobacter, E. coli, and Listeria, and then estimate the potential risk to health by combining 2 factors. The first is the severity of harm. So is it a stomachache or is it liver failure? And combine that with the likelihood of infection per serving. So it's not about the total amount of infections. So it's about how likely is this food to make you severely ill every time you eat it. And we can see why this is important by using an analogy of transport. Plane crashes, when they happen, involve a much greater number of casualties. So on the surface, it seems like planes are inherently more dangerous than cars. But when you look at the total amount of journeys taken compared to the accidents, that's not the case. So looking only at the total number of deaths doesn't tell you which one's safer. You need to look at the total amount of journeys made by each transport method. And it's the same with food. Raw milk is consumed by many times less people than raw salad. And so the total number of infections is meaningless. And here's what the data actually shows about unpasteurized raw milk. Unpasteurized dairy causes 840 times more illness and 40 times more hospitalizations than pasteurized dairy in the US. And it disproportionately impacts children and pregnant women, causing severe outcomes like kidney failure, miscarriage, and stillbirths. And pasteurization removes this inherent risk whilst maintaining nutritional quality. So the proteins, the fats, the calciums, the other nutrients essentially stay intact. Now let's break down the 274 times more dangerous claim, because it's good to look at the data behind these claims. Paul Saladino cites CDC data, which shows that 2.2 million illnesses arise from eating leafy greens. What he doesn't explain is how he's arrived at this 274 figure, or what raw milk figure he's used in comparison. And most importantly, he doesn't mention that many more people eat raw salad than they do raw milk. He also leaves out some other key things from the same dataset he's quoting. So the same CDC dataset shows that dairy accounts for the largest share of hospitalizations related to foodborne illness and a really high share of deaths. And later breakdowns show that unpasteurized milk account for a very high proportion of outcomes. Later breakdowns show that unpasteurized dairy accounts for a high proportion of outbreak illness when you account for exposure. So this is textbook cherry picking, using one figure, in this case illness from leafy greens, while ignoring other data such as exposure and severity. It's also important to note that raw milk is not unfairly singled out. And official guidance for pregnant women includes many food groups such as soft cheese, deli meats, unwashed salad, and unpasteurized dairy. But the emphasis on raw milk reflects recent survey data, which shows that many adults don't really understand the risks of raw milk, especially on children and pregnant women. So here's what informed choice actually looks like. We need to have a realistic picture of the benefits, evidence-based differences between raw milk and pasteurized milk, and evidence showing the risks of that compared to unwashed salad. We need to have a realistic picture of the risks, the illnesses, the hospitalizations, the deaths per serving, especially for those vulnerable groups. And this transparency must extend to social media, not just hidden away in an official guideline. Some people claim that raw milk can cure lactose intolerance. So Christopher Gardner, a scientist, examined this claim in a Stanford trial in a randomized double-blind study, and found that there was no difference between raw milk and pasteurized milk. And actually, in some measures, lactose malabsorption was higher in raw milk than in pasteurized milk. So this is why it's important to remember that, oh, this worked for me, oh, I know a friend, oh, this influencer tells me. That does not compare to scientific evidence. Now, don't get me wrong, you're free to choose what you eat, but bold claims and big numbers deserve scrutiny. And when you see a viral stat like 274 times more dangerous, you have to ask yourself, 1, what is the source? 2, what's the exposure? And 3, most importantly, what's being left out? For the full breakdown of the sources and the evidence, please check out the full article, which will be linked in the description of this video. Food Facts is a volunteer-led nonprofit backed by an expert advisory board of over 60 experts across nutrition, health, and food systems. They help us to check the evidence and bring you evidence-based answers. To support our crucial work and to help us scale, please check out the link in the description of this video.